A dental crown is a restoration that essentially covers the tooth up. They're usually indicated when there are problems with the tooth, when it's broken, cracked, or has a cavity that's too big for just a filling to take care of. So with a filling, we might drill out a little cavity and fill that hole up with the filling material. But for a crown, we do a crown when we need something stronger, something to completely hold the tooth together. So basically a crown will fit on top of a tooth. That's why we call them caps sometimes. They're typically nowadays made out of ceramic, the same color as a tooth, and they're extremely strong. They're a good way to rebuild a tooth. I think of it as essentially replacing the enamel that has gone bad on the tooth. If you feel like you might need a crown, that's a good reason to come in. If you feel like you have a dental problem that might not be a small one, let us know and we'll see if a crown will work for you.